Overall incidence of complications for catheter ablation of atrioventricular reentrant tachycardia is about 1 to 4%. Potential complications of vascular access: Haematoma, deep vein thrombosis, perforation of aorta, AV fistula, pneumothorax. Potential complications of catheter manipulation: valvular damage, microemboli, perforation of coronary sinus or myocardial wall, coronary dissection or thrombosis. Potential complications of delivery of radiofrequency energy: AV block, myocardial perforation, coronary spasm or occlusion, TIA or stroke. The incidence of complete heart block is about 1% and is likely to occur with ablation of septal or posteroseptal pathways. Procedure-related death is very rare, less than 0.2%. It may be noted that overall, catheter ablation of AVRT is a relatively safe procedure, though there are a number of listed complications.